here to talk on this urine leakage. Today is your day. So we are back with Dr. Rovers. Now, our question is, how are incontinence cases diagnosed? How are they diagnosed? Doctor?
Well, the most important is that if someone tells that she loses urine, that we have to be sure that it is really urine. That sounds like a stupid or easy thing, but sometimes it's not urine. So then, in fact, the diagnosis is as easy that if the patient tells that she loses urine, we consider her to have urine leakage.
Okay.
And then the next step is to find out what type of urine leakage. So we ask, and the two types, remember, are one of them when exercising, when pushing and so on. So we just question that. We say, okay, when do you have urine leakage? And the other type was the one that is associated with very frequent voiding and always having to hurry.
Okay.
So sometimes we ask them to keep a voiding diary.
Okay.
Which means that during 1 or 2 days the patient writes down when she voids, how much she voids, when she loses urine, whether she has to change pads and so on.
Yeah.
Just on a small paper, the times and the amount of leakage and so on. So we call that a voiding diary.
Okay.
Another thing we always do with our patients is that we check if they don't have cystitis, bladder infection. Because if you have a bladder infection, it's also related to incontinence.
Okay.
So we check their urine.
Wow.
Another thing that we always check is whether they can completely empty the bladder. So we have a small ultrasound device, and after they have voided, we check whether the bladder is empty. Because if you don't completely empty the bladder, and it is always a little bit full, it's more difficult to control the bladder, and you are more likely to lose urine.
Wow.
And then if we have difficulties to differentiate the type of incontinence, we sometimes do what is called a urodynamic investigation.
Okay.
So we bring a catheter into the bladder.
Yeah.
And we measure the pressure in the bladder and in the closing system, and then we fill the bladder, and we look how the closure of the bladder is organized and if it is okay or not.
Wow.
Yeah.
So, does pregnancy really leave a lasting problem with a urine leakage?
Yes.
So all of these women who have been having 7 pregnancies, you know, so they have 7 children, then they must have big and great leakage.
That's interesting. We found out that it is mostly the first child, and not the number of childs,
but
the first child. So we always say to our patients, you can have as many children as you want, but don't take the first one, start with the second. Unfortunately that doesn't work. Interesting, we thought for a long time that it was vaginal delivery, and that cesarean section would protect the pelvic floor from having incontinence. But now we know that it is also the pregnancy itself that increases the pressure on the pelvic floor, and there's also some risk factor to get incontinence.
So after child delivery, it goes.
After child delivery, it can go, and of course you also have people who are more sensitive for it than other people. We have complete families. All the sisters and the mother have this problem, and we have other families where it is far less common. So it is also genetically, there's also a genetic factor that determines whether the given delivery is a problem or not. And interesting enough, we also know that it is race dependent. So
race.
Okay. Yeah. So African-Americans have less risk on incontinence than Caucasian.
Really?
Yeah. And it's because of the collagen type.
Because I was about to ask that question. Is the incontinence affected by weather or race or?
Not weather, but it's race. The type of race is related to the type of connective tissue.
Oh.
So Africans have better connective tissue, but it doesn't mean that it doesn't happen.
It happens too.
It happens too. It's a little bit less common,
Okay.
but it still happens.
Do you think it's not about the food that they eat? Because
We don't know.
sometimes people say, you know, like, you know, I'm married, I'm from Nigeria, and my husband is from Ghana, and I've often heard the ladies speaking about, oh, don't take too much chocolate, don't take too much of this, and don't take that, because you will have leakage. So is it not because of the...
That's a very good question. We don't know yet. We have just, you know, it's not you just starting to talk about it, it's everyone just starting to talk about it. So we still have, you know, a lot to find out and a lot to learn about this topic. And we started at the treatment, and we have learned a lot about how we can treat this condition, but how it develops, and the question whether food plays a role and what you eat. It's very interesting, and we just have to know. I know that for the type of incontinence where you have to avoid very frequent and have to hurry, that if you drink coffee, that it is making things worse.
Oh!
Yeah. So, and also other things, and smoking, for example, is also bad for your bladder. So it makes you respond different to the filling of the bladder than not. But about chocolate, I don't know, and I would be a little bit afraid to tell those things, because if they are not true, people are afraid and they think it's true, and then they stop eating all the things that they like to do.
Yeah, exactly.
And if you can do the things that you like to do, you have to do it.
Well, ladies, give us a call on 027371619. It will do you good to call us now than to send emails or SMS and telling us the program is very good. Yes, it's very good, but you can call Dr. Roovers right now and get your answers to whatever problem you are having pertaining to urine leakage. Now, I want to ask you something very, very strange. Can incontinence, urine leakage, can it come and go? Yes or no?
It can come and go. For example, if you have an infection of the bladder. If you have an infection of the bladder, it's very difficult to control the bladder, and taking antibiotics for the bladder infection will also sometimes then solve the problems of incontinence. And
have you been able to solve any of those problems to those women who have been coming to you?
Yes.
Okay.
Yeah, so sometimes, So the second thing is that sometimes we hear women and they come and they say, well, I had a very severe cough, a very severe cold, and I was coughing and sneezing, and I had leakage, but now I'm healthy again, and the leakage went away. But mostly that's a first sign of incontinence. At the moment that you have a start of incontinence, mostly over time it just gets more and more severe.
Wow.
And then it will not disappear before we give treatment.
So, how does incontinence impact the quality of life?
Very much. We hear women who are afraid to leave their home. If they go somewhere, they know on every place where there is a toilet, they always carry a bag with pads, you know, and they will adjust the clothes that they are wearing to their incontinence. They lose relationships. They lose sometimes the ability to have sexual intercourse, and it may affect their marriage. We have heard stories of women who even lost their job because they had to go so often to the toilet that their boss told them that they are not working hard enough. So, you know, this may severely affect a human life. And the problem is because it develops so slowly that every day it's a little bit different than the day before, and you sometimes just get used to the bad habits, and you don't see anymore where you came from, and you have just, you know, accommodated, but affects you lost a lot.
What is the normal amount of time between voiding?
Normally people void a maximum of 7 times a day. That's what we call normal. So it depends on what you drink and how much you drink and the moment of the day. So in the morning Most people start with 2 voids in quite a short amount of time. But I would say that on average it's something like 2 to 3 hours in between voids.
Okay.
But
so
of course, if you go to a party and you drink some more, then you have to void more.
So what can women do to ease the problem associated with stress incontinence?
If you experience that you have stress incontinence, I think it's important to go to your general practitioner, ask some advice, to look at our website, for example, the Alandvrouw website, and see what can be done. Some people think that if they drink less, that they lose less urine. But in fact, that is bad for the bladder, because if you drink less, the urine gets more concentrated, and it irritates the bladder more.
Well,
and it's bad for the kidneys to don't drink. So you should not drink less. That's not a good solution.
Wow. Do you know of any home remedy for this problem?
I've heard many, and it depends really on the culture to who you are talking. But maybe I can ask you. Have you heard remedies that you want to ask something about, or?
No, I don't. You know, I happened to hear of this when I was talking with a gynecologist in US.
Yeah.
So then he was discussing with me and my senior brother, who is a thoracic surgeon, and about urine leakage.
Yeah.
So I was wondering, he asked me whether I know do I have leakage? I said, I don't know what is leakage.
Okay, that's a good sign.
Yeah.
If you don't know, you don't have problem. Yeah. Well, you know, but you mean home remedies, right?
Yeah.
Something that people do at home. And in fact, what I would advise them is to do some exercises.
Yes.
But still, you can also do the wrong exercises. So you should get some advice which exercises that you have to do. And then, of course, there are some cultures that have beliefs or religion or habits that they think also helps incontinence.
Really?
So there are, for example, in the East, there are people who burn herbs and they squat above the herbs, and they think that it strengthens the pelvic floor muscles.
Yes.
But we don't know. As we don't know it, we don't advise it.
Well, ladies out there, in case you want to have the number of the clinic, Alandvrouw Pelvic Center, give us a call on our mobile phone, and then we can give that to you. Call us on 0684 606 550, or you call 027371619. Then off the air, I'm going to give you the number.
Maybe it's good to tell something about prolapse, because some
prolapse, doctor, we're going to have that again with you, because that prolapse, I think that is very important. I have questions for that, but for the sake of time, that's going to be a different topic altogether. Because the prolapse, I saw some diagrams that I said no.
Because it's related to incontinence.
Yes, we're going to talk about that, because that will be very good. Okay. So the next discussion will be on vaginal prolapse, or Dr. Roovers called it vaginal collapse.
Prolapse.
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 So that is a protrusion in the vagina.
Yes, very good.
That's it.
Yeah, exactly.
You see, I'm not a doctor, but
you're an expert.
So, in case you are having protrusion in that area of your body, there's a solution too. So, what do you think you have to say to our listeners today, Dr. Roovers, as a final word before we sign off?
I think most important is don't stay at home and think that there is no solution for you.
What are the available treatments? Just say one or two or three.
The available treatments are pelvic floor exercises, physiotherapy, and if it doesn't work, surgery. And it is most important to discuss your problems with someone who is an expert on that field, to ask if there is a solution for you.
So does Alandvrouw Clinic give advice on that?
Yes, we do.
Wow.
Yeah, that's the only thing we do.
Okay. So anybody outside there, any lady, you want to have the number of Alandvrouw, you can also Google it, Alandvrouw.nl.
Yeah.
Or you can call us. If you do not have internet, you want to call us, I will give you the number and also the office number of Dr. Roovers. Is that good?
Perfect.
All right.
Yeah.
So, say your last words to us and.
No, thank you very much for being here. I really believe that by doing these programs and by talking about this problem, we reach out to more people.
Yes.
And we discussed how bothersome these problems are.
It is.
And I'm always happy to spend time to tell people that it can be solved.
Wow. Thank you so much, Dr. Roovers, for coming.
Thank you for having me here.
Well, listeners,